Good afternoon, everyone. Welcome to our December session of the Back to Baseline webinar series. And today's webinar is on understanding culturally and linguistically appropriate services, otherwise known as CLAS standards. And for those of you who've joined us before, of course, we're glad to have you back. And if this is the first time you're joining us in this webinar series, we're definitely glad to have you too. This webinar series, Back to Baseline and Beyond, the post-COVID management of patients with chronic conditions, is focused on helping care providers across the continuum of care use lessons learned and look at new ways to improve the management of chronic diseases and conditions, and to help improve outcomes for our patients. So please take a minute to enter your name, organization, or facility, and your role in chat so everyone can know who has joined us today. And my name is Gray Ficker, and I'm a member of the Superior Health Quality Alliance Chronic Disease Management Team. And a few housekeeping notes before we get started. If you could keep your line on mute unless you are asking questions, it will definitely help keep the background noise down to a minimum. And following your presentation, we will have time for a discussion and time to answer any of your questions. Please feel free to place any questions or ideas in the discussion. And if we have during the session in chat, we'll definitely make sure to answer them. And we ask that you be patient with us and wait till the end for us to get through all of them, or just follow up after as well. But with that, I'd like to turn over to our speaker today, which is the great Carrie Finley. And Carrie, the floor is yours.
Okay. Well, hello, everyone. My name is Carrie Finley, and I am a registered nurse and a quality improvement advisor with Medistar, which is based out of Madison, Wisconsin. And Medistar is also a partner with the Superior Health Quality Alliance. So I'm very happy to be a part of your conversation today and to share information about the National CLAS Standards. What I'm going to do before we get started is I am actually going to turn my camera off. I just want to ensure that my internet is going to be running for everyone so that I don't have any interruptions. So my apologies for that, but I'll turn it back on when the presentation is over. So these are the learning objectives for us today. And displayed is what I hope we will accomplish at the conclusion of today's learning session. From reviewing the learning objectives, as you can see, we have a lot to go over. And my goal is to review the what's, the whys, and the hows of the National CLAS Standards. And so we have a lot to cover today and a lot of information to share with you. So we'll go ahead and get started. But before we get started, I do want to start us out with a polling question. So Jerry, are you able to display? There it is. So the question is, how familiar are you with the National CLAS Standards? So if you want to go ahead and take a moment just to answer. All right. And it looks like everyone has answered. So I'm going to go ahead and end that poll and share our results. And as you can see, we're kind of 50-50 with not really familiar at all or somewhat familiar. So this will help me as I move forward with this presentation in regards to how deep to dive into the content. All right, let me advance the slide here. All right, so we're going to first get started out with reviewing what are the National CLAS Standards. And in order to review them, I think, or in order for us to get started, I think it's really important to discuss what exactly does culturally and linguistically available services mean? So the purpose of this presentation, cultural competence, means that organizations have a clearly defined, congruent set of values, principles, and they're able to demonstrate behaviors, attitudes, policies, structures, and practices that enable them to work effectively cross-culturally. That is a mouthful. And then linguistic competence is the capacity to communicate effectively and convey information in a manner that is easily understood by diverse audiences. And that includes persons of limited English proficiency, those who have low health literacy skills or are not literate, and also individuals with disabilities or who are deaf or hard of hearing. And it requires for services and supports to be delivered in the preferred language and or mode of delivery of the population that is served. So CLAS essentially is a set of guidelines or action steps that allow organizations to provide these services with the end goal of being respectful and responsive to each person's cultural and communication needs. And how did this come about? I guess I just wanted to share a little bit of background about our National CLAS Standards, is that they have been around for quite a bit of time. They first started thinking about this idea. When I say they, I mean the Health and Human Services Office of Minority Health way back in 1997. And then they first implemented the National CLAS Standards in the year 2000. And kind of got some feedback from some public forums and different folks about how the standards were set up. So then in 2013, they made some major revisions, and now the standards are what we have today. And the revisions have resulted in much broader guidelines and is also more user-friendly. So who needs to use the CLAS standards? Well, the National CLAS Standards can be applied to a wide array of professions and sectors. These organizations can include hospitals, family health centers and clinics, public health clinics, practitioners who accept Medicare or Medicaid reimbursement, mental health centers, alcohol and drug treatment facilities, and also extended care facilities, nursing homes, and more. So then we get into what are these categories of the National CLAS Standards? And the National CLAS Standards for culturally and linguistically appropriate services in health and healthcare give health organizations 15 action steps, and for providing CLAS within these following 3 themes, which is governance and leadership, communications and language assistance, and engagement, continuous improvement, and accountability. And we're going to go through each of the different themes and standards in just a little bit. But just to know that, as I've mentioned, it's essentially a blueprint for healthcare providers and organizations. And hopefully I won't feel like a broken record, but the goal is to better serve diverse communities through culturally and linguistically appropriate services. And this is just really to provide the guidelines in order to do that. So I put in this slide, and I apologize because it is a little bit difficult to read, but we really wanted to give you a visual reference. I'm a visual person, I'm a visual learner, and we felt the screenshot of what the Health and Human Services Department website looked like, what the official copy looked like, would be helpful. And so we did put the link in to this PDF. So if it would be helpful to you to actually pull up the PDF and review it as I go through each of the themes and standards, by all means do that, so that the different categories are more clear. So the very first theme or standard, because it's actually both, is the principal standard. And this essentially sets the stage. It calls on the organization to provide effective, equitable, understandable, and respectful quality of care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. So in other words, like, what does that mean? Well, it means that we need to provide a safe and welcoming environment at every point of contact. CLAS allows organizations to meet the communication needs so that individuals can access healthcare and services they receive to effectively participate in their own care by making informed decisions, resulting in improved health outcomes. So by meeting the standard with more and more providers and patients, the end goal is to alleviate and help eliminate discrimination in healthcare and health disparities. Our second theme is governance, leadership, and workforce. And I apologize, I misspoke. It's our first theme. And the purpose of this, to implement this CLAS standard successfully, an organization must be able to direct its attention and resources to the needs of culturally diverse populations. So in other words, it's to plan strategically. In doing strategic planning, an organization seeks to define and structure activities, develop policies, and set goals that will empower it to provide culturally and linguistically appropriate services. So the implementation of CLAS is the responsibility of the entire system. Implementing CLAS requires the investment, support, and training of all individuals within an organization. An organization's leadership shapes the culture of the organization through its priorities, expectations, and the behavior that it models. So this standard teaches us that implementing CLAS at every point of contact is critical to the improved quality of care. And then we have our second theme, which is communication and language assistance. This theme broadens the understanding and application of appropriate services to include all communication needs and services. And that includes sign language, Braille, oral interpretation, and written translation. Our third theme is engagement, continuous improvement, and accountability. So this theme emphasizes the importance of establishing both individual and organizational responsibility for implementing CLAS. Effective delivery of CLAS demands action across the organization. Theme 3 outlines how organizations should continually keep in touch with the communities they serve to be aware of their clientele, the languages they speak, and the cultures they represent. So now after I reviewed the themes in just a bit, we'll go through the 15 action steps that are a part of the themes. But for right now, we'd like to ask another polling question. So I'll have Jerry post the polling question for us. And that one is, and you may or may not know, that's okay, we're learning, how consistently does your organization support cultural and linguistic diversity through hiring, promotion, education, and leadership policies? All right, and we'll just take a few moments for everyone to answer. And it looks like we have feedback from everyone. Let me go ahead and end our poll and share results. So as you can see, we're pretty equal across the board in regards to response. So everyone is at a little bit of a different place in regards to how your organization supports cultural and linguistic diversity. And this will be helpful because at the end, we would like to have, as Gray mentioned, some interactive discussion, and then we'll reflect back upon the polling results as well. So I'm going to stop sharing that. And then we'll move on to our next section. Give me just a second here. There we go. So I talked a little bit about the whats. Let's get into the whys. So first off, we know the CLAS standards are proven effective. They've been around a while. And so there's been some opportunity to review those standards and how they improve engagement with patients and families and improve staff satisfaction. And we also know that CLAS standards, the implementation adds value to organizations by consistent and ease of adapting to changing demographics and also improve care experiences of people of diverse racial, ethnic, and cultural backgrounds. We also know that CLAS standards implementation improves the quality of provider health center services, improvement for better leadership, staff, provider, and patient and family experiences and engagement, and an overall sense of belonging. It also ensures compliance of local, state, and federal legislative and regulatory and accreditation mandates, and this can increase business potentials effectively of marketing and public relations for community health campaigns, increase patient and provider safety and satisfaction, and result in decreased amounts of incident reports, complaints, injuries, investigations, and reviews, provider liability, and malpractice claims. I just wanted to share a brief case study that was rather recent about now that we know CLAS standards can help healthcare organizations. Let's discuss the ongoing COVID-19 pandemic. What we found through the COVID-19 pandemic highlighted healthcare and medical service gaps and also provided insight on the depth and number of opportunities for consistent improvement for population level infrastructure, investment, and emergency preparation. Community level health disparities across regions are reflected in the lack of safety, health, and resource availability for individuals who embody historically excluded groups, often simply due to preventable issues to ensure every person have their needs met before, during, and after they enter their healthcare space. So for example, many patients don't share language, cultural reference, or interpersonal experience with their medical providers. And what we found was during the pandemic, there were refugee populations that had less access to care and lower health outcomes. So our recent case study in the United States showed that using culturally and linguistically relevant messaging in combination with health literacy best practices helped to dispel myths about COVID-19 vaccines, and that actually combated misinformation. So what occurred was that the strategy resulted in improved behavioral mitigation, such as proper use of face masks, hand washing, and physical distancing. So that said, both studies noted how a message that is not linguistically and culturally appropriate can reduce trust in the public health messaging. So in other words, the conclusion of this is that doing our homework, thinking before we ask, makes our messaging more credible and effective. So I do have another polling question. So we'll have Jerry display that. And this one is, how consistently does your organization provide understandable, accessible healthcare related information to patients and families via multiple formats such as verbal or written? All right, and let me go ahead and end the poll. Thank you everyone for answering, and we'll share those results. So as you can see, again, we're still pretty consistent in regards to where everyone is at with implementing CLAS within their organization. Which is a really good segue, because the next section is how. And this gets into those 15 action steps that I had mentioned earlier. So now that we have discussed the overall principles, benefits, and goals of adopting the National CLAS Standards, we're going to delve a little bit deeper into what those action steps are. So our first action step and standard is the principle standard. And this again sets the stage for introducing class to an organization. Action items 2 through 4 address the roles of governance, leadership, and workforce. So standard number 2 emphasizes how class must be integrated into every aspect and level of healthcare. We know leadership are prime examples of how an organization's culture embodies staff and patient quality, safety, and class standards. Standard 2 requires long-term, ongoing, and adequate institutional investment and logistics to properly allocate resources to ensure long-term permanent staff, resources, programming, and everyday support to sustain class initiatives, as well as to model an appreciation and respect for belonging, inclusion, conflict resolution, and everyday adjustments. Standard number 3 points how class standards require education, recruitment, hiring, mentorship, promoting, and supporting different bodies, abilities, and experiences in organizational leadership and workforce. So organizations that support and affirm the differences in their staff, leadership, providers, reflects results that shows individuals feel more welcomed and valued, as well as integrate multicultural and interpersonal perspectives. Standard number 4 helps organizations prepare, encourage, and support a workforce educating, training, personal and professional development, critical thinking, and mentorship. In our next theme, communication and language assistance, these action items provide guidance on how to effectively meet patient communication needs. And again, this includes sign language, braille, oral interpretation, and written translation. In addition, the action items in this theme will help organizations comply with the federal requirements such as Title VI of the Civil Rights Act of 1964, the Americans with Disabilities Act of 1990, and then other relevant federal, state, and local requirements. So to dive a little bit deeper into these action steps, standard number 5 essentially has to do with offering communications and language assistance, which helps an organization make sure that individuals with limited English proficiency and or other communication needs have equitable access to health services. It also assists organizations to improve patient safety and reduce medical errors related to miscommunication. Standard number 6 has to do with informing individuals of the availability of language assistance services, which will help organizations inform individuals with limited English proficiency in their preferred language, and that language services are available at no cost. Standard number 7 has to do with ensuring the competence of individuals providing language assistance. And this will help organizations provide accurate and effective communication between individuals and providers, as well as empowering them to be able to make informed decisions about their health. And standard number 8 has to do with providing easy to understand materials and signage, which we referenced earlier in our polling. And this will help organizations make sure that readers of other languages and individuals of various health literacy levels are able to understand and access care. As we continue, our final theme is theme number 3, engagement, continuous improvement, and accountability. As I had mentioned earlier, this theme identifies the importance of establishing both individual and organizational responsibility for implementing CLAS. The effective delivery of CLAS demands actions across the organization. So this theme's focus focuses primarily on the supports that are necessary for the adoption, implementation, and maintenance of culturally and linguistically appropriate policies and services. A main takeaway is all individuals are accountable for upholding the values and intent of the CLAS standards. So this means that everyone in the organization has a part in implementing and living the CLAS standards. So to dive deeper, number 9 has to do with infusing class throughout the organization's planning and operations. This will also help organizations make class central to the service, administrative, and supportive functions, as well as link class to other organizational activities. So what this means really is that all of the plans your organization is developing, that they should be culturally and linguistically appropriate, and make sure that all of your plans have class within them, not that they're an add-on. Standard number 10 has to do with conducting organizational assessments, and we'll talk about that in just a little bit as well. This will help an organization assess the performance and monitor the process in implementing class standards. Collecting information about the organization and the people it serves can be used to improve services. Number 11 has to do with collecting and maintaining demographic data. So it's all about the data. This can help organizations accurately identify population groups within a service area and also monitor individual means, access, utilization, quality of care, and outcome patterns. This may also help with outreach and community-based initiatives. Standard 12 focuses on conducting assessments of community health assets and needs. So this helps an organization to determine the service, assets, and needs of the population in the service area. It can also assist with a resource inventory and gap analysis of what is needed, which can help to implement services. Standard 13 has to do with partnering with the community. So this will empower members of the community in becoming active participants in the healthcare process. Number 14 focuses on conflict and grievance resolution and creating those processes that are culturally and linguistically appropriate and are open and transparent and allow for two-way communications and feedback mechanisms. And our last actions item, standard number 15, has to do with communicating the organization's process, which will help organizations convey the information about their efforts and accomplishments with meeting the National CLAS Standards, as well as building and sustaining communication on class priorities and building trust between the community and the service setting. So now that I reviewed each standard and action item, that may feel a little bit overwhelming. So I wanted to focus on ways that can be helpful with the implementation of the CLAS standards. One approach that could be used, and I do have the link to the checklist at the bottom of the slide, and it's also in our resources slide as well. But an approach that can be used as an organizational assessment or a checklist. And so as you can see, I've provided an example checklist. I apologize, it's just a little bit blurry. But what I wanted to share with you is completing an organizational assessment will give you an idea of what is currently occurring in your organization and then the areas that could be worked on. There's no single correct way to implement the National CLAS Standards. So after completing an organizational assessment, your organization may decide to implement some, but not all of them, or some sooner rather than later for others. So once you've completed an organizational assessment, a next step would be to identify strategies that can be implemented to meet the standards. So for the sake of time, I have listed examples of like 3 ideas that can be used per theme. So under governance, leadership, and workforce, strategies that could be used would be to train staff in class. There are several modules available that staff can complete about class. We've also created a handout that can be shared with staff about class, and there will be the link to that at the end of this presentation as well. It's a high-level handout that provides a really nice overview of why class standards are important. Another approach is recruitment of a workforce representative of the community served, or if there's limitations, to bring in volunteers or visitors from the community that have diverse cultural backgrounds to share music, art, and stories of their culture, race, or ethnicity. Another approach would be to create and support a designated class position or work group. This may help to have accountability and responsibility for the implementation of class. For the theme communication and language assistance, approaches that could be used would be to offer comprehensive language assistance services. The recommendation is to set up a third-party interpreter service, and I know a lot of people use these services. The main takeaway is to not use family members as interpreters for legal documents or to discuss important topics with patients. Providing staff training on communication and language techniques for patients whose primary language is not English, including nonverbal communication training such as sign language, may be another approach. Require interpreter skills to be certified or assessed. Sometimes we have staff that indicate they're fluent in a language, but it's important to ensure that those language skills are through certified medical interpreters, especially when discussion is for legal documents or key decisions. And then to use advanced technology for interpretive services. An example of this would be like website translation or document translation. Under engagement, continuous improvement, and accountability. An example, right, I should say the first two, improve collection of race and conduct organizational assessments, are all about the data. So determine what data collection mechanisms you have and how to utilize them. And then finally, question, what is your mission, vision, and strategic plan? Is class integrated into it or just indicated? So determining if that has been taken into consideration within your organization as well. Okay, so we have I believe, final polling question. So Jerry, I'll have you display that polling question. Oh, is this the old one? There we go. Number 4, how consistently does your organization use patient family feedback and demographic data to establish, plan, implement, and evaluate your class efforts? So I'll just give you a few moments to complete that polling question. All right, it looks like we have most everyone who answered. So I'm going to go ahead and end, and then we'll share results. So as you can see, again, everyone is at a different area within the organization for how they're using that data. And we will discuss those results a little bit more within our discussion time. So I'm going to stop that. Okay. So I just wanted to touch briefly on class and health literacy. I feel it's really important to focus on the correlation of our national class standards and health literacy. Implementing class standards is one strategy to improve health outcomes by accounting for the culture and language of the people an organization serves. However, it's very effective when it's used with other efforts, like accounting for variability and health literacy. So health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. But how do class standards and health literacy work together? So this diagram gives us a few examples of how individual characteristics such as age, education level, culture, and language, as well as many others, can impact our ability to understand and apply health-related information. So in turn, this affects our health outcomes. And this includes kinds of protective behaviors we engage in and the use of our healthcare services. So if we can communicate with patients in ways that account for their individual characteristics and their health literacy levels, we can help these patients navigate and use the healthcare system in ways that'll work for them. Especially organizations that adopt class standards and provide materials for people with lower levels of health literacy. This helps more people access the services and care they need. So this next slide displays that there's two important parts of health literacy. We have our individual health literacy, which is the degree to which individuals have the ability to find, understand, and use information. And that is to make informed health-related decisions for themselves and others. And this is pretty much what we covered in the previous slide. But there are many factors that impact whether someone has higher health literacy, lower health literacy, or if they're somewhere in between. This is what most people think of when discussing health literacy, and it's helpful to think of it as a state rather than a trait. So everyone can learn about and improve their skills related to finding and understanding health-related information. As we saw in the last slide, there's a lot of evidence that health literacy is related to health behaviors, health status, and health outcomes. People with higher health literacy tend to smoke less, exercise more, report better general health, visit the ER less frequently, and perform better chronic disease self-management. The other piece of health literacy is organizational health literacy. And this is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. This can include using strategies like the teach-back method when interacting with patients, as well as using plain language in patient communications. So it's a good idea to structure the delivery of care as if everyone may have limited health literacy. So you cannot tell by looking at someone whether they have higher or lower health literacy. Health literacy skills don't always mean full understanding. And anxiety can reduce someone's ability to manage health information. And everyone benefits from clear communications. And on this slide, I provided some tools to promote health literacy. So we have two toolkits and then some plain language resources that can assist you with that. I just wanted to touch briefly as well on the CLAS standards and chronic disease management. So we know that medication adherence and diet and weight control are essential contributors to blood pressure and diabetes management. We also know that low health literacy is associated with poor health behaviors and outcomes among adults with hypertension and diabetes. So although a healthcare provider has medical expertise about treating a disease or condition, a patient is the expert of their own life and body. And that's why it's so important to learn about patients' social identities, life experiences, values, perceptions, communication needs, history, and more. Eliciting and listening to that information in a respectful and compassionate manner is key to providing high quality care. I wanted to share with you a list of CLAS resources, and these are the resources I used within this presentation. And then also I have, this is the CLAS information guide, and this is the link to the flyer, which may be really useful when trying to explain what the National CLAS Standards are to other members in your organization. So it gives a nice high level overview of the who, what's, whys, and hows. And then it's not displayed here, but on the second page, it also gives a list of resources, including interactive toolkits, some video vignettes, and some different websites you can access. this is my contact information. And before I hand it off to Gray, I just wanted to share in closing that culturally and linguistically appropriate services are increasingly being included or referenced by local and national legislative, regulatory, and accreditation mandates. Both the Joint Commission and the National Committee for Quality Assurance have established accreditation standards that target the improvement of communication, cultural competency, person-centered care, and the provision of language assistance services. So even without a regulatory mandate, looking holistically at improving health literacy can help healthcare organizations gain a competitive edge in the marketplace, decrease liability risks, and provide equitable, safe, and quality healthcare and services. So in closing, the pursuit of health equity must remain at the forefront of our efforts, and CLAS is a way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity. So with that, I will pass it off to Gray, but I believe I still have control of the presentation. So we'll share this slide and then I'll start my video so you can see my face again. There we go.
Okay, so let's share some of the results from the poll and then we can start a discussion here. And let's see, share results. Yep. Okay, great. So this was question 1. Most people said that they were not familiar with the CLAS, National CLAS Standards. And then some people said they were, but no one was very familiar with it. And does anyone want to share their thoughts about if that's changed or not? I think it has for me, especially. But anyone else in here, let's have some sharing of experiences with CLAS standards now that we've had our presentation.
And feel free to either take yourself off mute or just put your answer in chat is fine too.
Thank you, Jerry. Yes. Okay, so I can share something. When I've worked at federally qualified health centers before and some hospital systems, and the FHQC, or the Federally Qualified Health Center, that I worked at targeted specifically Spanish-speaking and Latino communities in Michigan here. And so I was one of the standard translators because I have a certification in Spanish. And I had a whole team of community health workers who are also certified, not only in language translation, but in health literacy and community health worker needs. And we had a whole group of translators. And it was the first time that I was either not the only Spanish speaker or one of like 2. And that really helped me understand the possibilities of how CLAS standards can be applied. And so this is a great list of things that some hospitals already do, they don't even think of. So I hope that shows. And then, so the second one here, we see that a lot of people said that, like Carrie said, oh, okay. And then we have something from Vanessa here that you only became aware of CLAS standards in the past year, and you were surprised that it hadn't come to your awareness before. And I think that's a great way to look at it, right? It's an opportunity because it doesn't have to be overwhelming. And I think a lot of us make adjustments every day that we don't even think about because we're used to making certain adjustments for some people, even for ourselves. But it really is just about making sure that every time we are talking to a patient, our coworkers, and talking to our providers even, and with leadership, whatever position you are, that you're making sure your message is for the people that you intend it to be for, and that they're able to receive it and use it. So, but let's talk about results overall. So I'm going to stop sharing here the results, and let's talk about times when we felt uncomfortable seeking medical care. what happened or didn't happen to make you feel that way? And obviously you don't have to name names or any specifics if you don't want to. We're just looking for general, overall situations. Or anytime you felt different. What about our patients? Anytime we've seen our patients feel different or our providers?
This is Amy from Memorial Medical Center.
Welcome, Amy.
Personally, when I feel understood by my healthcare provider, then I'm more likely to ask questions and engage in my care. Certainly if I have a feeling that they don't understand me, or it just closes down communication, and then I wouldn't be, feeling as comfortable to ask the questions and get the care that I've needed. And I would say that's a very similar, feedback that I hear from patients, right? If we're able to really meet them where they are, and ask open-ended questions, and they'll get a feel from us if we are genuine and sincere in our questions. We might not be experts at every background, but certainly they pick up on the sincerity, right?
Mhm, exactly.
So great
Thank you.
presentation. Thank you.
Carrie does a great job. We already know. And then I also see in here, Vanessa added that they think anytime a provider makes assumptions about a situation, it can be a problem. I wholeheartely agree with that, except for the fact that sometimes we can use our assumptions to make people feel comfortable. If, like our Amy here said, if it's sincere, if you sincerely suspect that someone might need help and they're not asking for it based on cultural context clues or your experience, asking in a respectful way or thinking about how you would ask or make assumptions can be helpful. The problem is when people make assumptions about when you do disclose, and I think that's probably what Vanessa is trying to reference here, or is referencing rather, that, if you can feel when someone is maybe acting or has made thoughts or jumped from what you thought wouldn't be a conclusion, they interpreted something completely differently, it definitely can lead to a lot of issues. So yeah, but let's change gears here. And what's something that you witnessed that made you feel like something else was happening, or you saw a patient or a provider, or even it wasn't happening to you directly, but it was happening to somebody else? Has that ever happened? And then how did you deal with that to help resolve it?
Can you give an example, Gray?
Yeah, exactly. I'm like,
So
okay,
we can,
my turn. It's all good.
Yeah.
So a huge reason why I got into healthcare in the first place is because I went from living in a city and then a suburb with there's a large population, a lot of resources, to living in rural areas. And I had never experienced a lack of a specialty or a lack of a hospital just based on location. And it was very difficult for me to go to a doctor and see them talk to people, and it was in such a familiar way that it made me uncomfortable because I had never experienced that before. I'd never experienced having one doctor for basically your whole life, your whole family, or any of your needs, or like someone who was a part of the community. It was always for me seen as we're going for this specific issue, for this specific thing, and I didn't see the value in that. Like I said, it made me really uncomfortable. I felt like the person was being way too familiar with me. And I was like, you don't need to know where I live, buddy, kind of thing. To understanding after like 2 years of living in rural Midwest towns that it was actually a huge benefit, because the doctor, after, I got to familiar with them, I understood, okay, they're not actually trying to be in people's business. they're not trying to learn about you to take advantage of you. They're trying to support you, and they're trying to show you different avenues and where you can go to get social support. That was an avenue of medicine and healthcare I'd never seen before and that actually is the reason I entered healthcare. So yeah, I think it wasn't just me. The reason I brought it up, it was because they were talking to everybody like that. And it was like, well, I know it's not just me, so at least I can still go to this person. But it helped resolve that. And now I understand how it can be a big advantage to have that. And I hope everybody has good healthcare and medicine that they need to. So yeah, but what are some things that stress people out or make them feel like they can't control what's going on around them? And what makes you feel connected to other people or reminds you that you can, what are the things that you remind yourself you can do when you're seeking healthcare? And like we said, feel free to unmute, feel free to pop it in the chat.
Well, I think it's interesting. I kind of had my own aha moment recently. As I'm navigating healthcare and advocating on behalf of my mother, it's really I find it fascinating in regards to health literacy. But we received a lot of information in regards to my mother's health and options that she could pursue. And then you get pages of written materials with your after visit summary. And it's interesting, but I recall walking out of one of the visits and we both kind of looked at each other like, what is going on? What are our next steps? What is it we need to do? Because the stress, we had high levels of stress and it was just really difficult to process in that moment. And reflecting back, it was just a really interesting aha moment for me in regards to utilizing that experience and then, applying it to others in the different scenarios they may encounter.
Yeah, I've been places where they say that having a sign on this like very unaccessible area that there are language lines is the same as having language support available. And I've seen, there's always people say that something's accessible, but, there's literally an infinite number of ways that our bodies can be individual ways. And so, and what does accessibility mean? It depends on the person. So saying something's accessible sounds nice, but have we made those actual efforts to just make sure that everyday people can still at least get help or that we can get to them? Is that possible? What is considered too much in your healthcare system? Or if you ask leadership, what are pushbacks or what are ways that they do support? And how can we help, be those examples? So, yeah. And it can be as simple as bolding the start of words or changing things from red to green to yellow and blue or orange and blue, simple color scheme changes like that. So, and also realizing like when I feel like things are out of control, I remind myself that you can't always do your best. You're not always going to do your best, and that's okay. Just keep trying. So, and then continuing to ask, and that's why it's not an everyday, or it's not a one-time done. It's not trying to avoid responsibility. It's also just make sure that we continue these conversations. So even if we can't talk about things today, definitely please continue to reach out to us. And definitely appreciate everybody's participation today and attendance. So let's talk about what's next here. And
Oh, before you do that, we have
Yeah.
one excellent comment in chat. If you want to
Thank you,
review
yes.
it, and then we can move on.
Oh, see, sorry, I really thought that was already mine. So Susan here says regarding health literacy, they've witnessed hospital staff assume someone was choosing not to take care of themselves instead of asking questions about accessibility to medication, understanding their insurance, and unfortunately, and other things. So unfortunately, they did not provide any resources for this person, but they were able to connect with a pharmacist who did and ask questions, educate appropriately. And the result was this person replaced their HPC with, or HCP, sorry, with their pharmacist, which is not a long-term solution, but words and attitude matter for sure. So at least they had a short-term solution, I'm assuming. So definitely, I hope that person continues. Thank you, Susan. That's a great example. Definitely. And it happens every day, unfortunately. So that's why we're here. So yeah. So we can continue this conversation on Superior Health Connect. And Carrie, do you have control of the slides still?
Yep, give me just a second
Okay,
here.
sorry, just want to make sure.
Here we go.
We're good. I'm jumping ahead. Yay. So we have a link here to Superior Health Connect, and it's a shared learning environment for Superior Health participants to come together. I'm just reading off the slide here, but just in case someone can't see, to foster and promote an all teach, all learn and climate, and provides the framework to improve and sustain mutual healthcare quality improvements initiatives locally, regionally, and nationally. And it's a great way to connect with coworkers and people who you may not work with directly, but have the same values and really do want to care. And then moving forward, our future topics here on January 17th, next month, we are going to talk about diabetes. And I'm super pumped for that. It's one of my passions. And this is a webinar series. So it's not just January, it's also February. We're going to talk about motivational interviewing and how to help people talk and motivate, and well, it's in the name, but we're going to be talking about patients and providers as well. And then in March, we're going to be talking about cardiac rehab and what your patient hasn't told you. So we'll be reviewing how to go through that process. And each of our webinars are on the third Tuesday of each month, and they happen at 12 noon Central Standard Time or 1 p.m. Eastern Time, and 3:30 p.m. Central Time, 4:30 Eastern Time. And on, we can talk about, yep, we're good. And if you want to register for the January 17th webinar and future webinars, we have the link here. You sign up for Superior Health Connect, and that way we'll get you in touch with future webinars and registration for January and in the future as well. And please contact Jerry Heinecker if you would like more one-on-one assistance, or if you have any questions. I'm also available if needed on an ad hoc basis for analysis requests. And we also just want to thank everybody for coming today. And it was wonderful to have our speaker here. And thank you as well to Jerry and everybody who supports us.
And can I just add one quick thing, Gray?
Yes.
Regarding the January, our next session, it's we'll also be featuring a speaker who will be talking about the annual Medicare wellness visits, which I think a number of you are very familiar with. And so the focus will be on those patients with diabetes and also chronic conditions, but it might be something too that you want to invite your billing people in your offices or hospitals from, because we'll be talking a little bit about billing too. So just wanted to add that.
Always fun. Thank you.